Hi, I'm Dr. Aaron Gan. I'm a hand surgeon that's practicing in Mount Elizabeth Medical Center here in Orchard Road. I've been in private practice for the past 10 years. Prior to that, I was a consultant in National University Hospital, the Department of the Hand and Reconstructive Microsurgery. It's only when I started school and I made friends with Shongwen, who is my current best friend, and he's been my friend since primary school. He has been the key person to influence me to becoming a doctor. Back then, we were basically competing with each other for grades. What I wanted to do was just to score as well as I could to enter the most rigorous program that I could. And at that time, NUS Medicine was one of the hardest faculties to enter in Singapore. So I just applied based on my A-level results, and surprisingly, I entered. I worked very hard in medical school. I passed, and then I started training as a doctor in 2005. Primary 3 onwards, we were classmates. When we were in medical school, we were in the same clinical group. So we really stuck together for quite a long time through our education career. So I'm very, very proud of my best friend, but I'm also happy that he inspired me to be where I am today. I discovered that I had an inclination towards surgery. I really like to use my hands to perform procedures, watch how senior surgeons perform procedures, and I was really inspired to be able to do an operation to treat a patient, to allow the patient to recover from his or her ailment. Initially, I was very interested in reconstructive surgery. So naturally, in the Department of Plastic Surgery, where they do a lot of reconstruction, for instance, for head and neck conditions where patients had large tumors removed to allow the patient to have a much better quality of life. So that was something which I really admired and I really was keen to pursue. Through that experience, I discovered the world of microsurgery. So microsurgery is a subspecialty skill which surgeons develop to handle very fine structures in the body. So for example, a microsurgeon will be able to repair blood vessels, nerves, and any structures that require stitching of these structures under a microscope. And I asked my professor in plastic surgery back then, which other department could I work in to further hone my skills in microsurgery, and he told me, why don't you explore hand surgery? In 2012, I was given the specialist accreditation by the Ministry of Health to be a hand surgeon, and then my journey as an independent hand specialist began.